Hi, everyone. I'm Marielle Sabato, and this is Opt-In, your pre-optometry podcast. In this episode, I get the chance to talk with Dr. Trang Nguyen, a developmental optometrist that works with patients who present with low vision at an early age. I've been lucky enough to shadow her practice, and I admire her role in child development and how she uses vision therapy amongst other tools to help her patients see a better future. Welcome. I'm glad to have you on here. Let's start out with introducing yourself, what undergraduate and optometry school you went to, and where you are now.
Okay, so my name is Dr. Trang Nguyen. I attended UC Davis as my undergrad. My major was physiology, and that was from 1985 to 1989. And then I went to Southern California College of Optometry, which I think now is called Ketchum, right? School of Optometry, I believe. And that was from 89 to 93. And then I did a year of residency in low vision at the Center for the Partially Sighted in 93 to 94.
Awesome. So we know that you're a developmental optometrist and you also specialize in pediatrics. So could you explain how that works? Because it kind of seems like you have a specialty within a specialty.
Yes, so
Okay.
there's general optometry, and then you can specialize in developmental optometry, you can specialize in contact lens, you can specialize in ocular disease, in sports vision. Um, so developmental optometry falls under the category of optometry, but specializing in children. And vision therapy is a big component of developmental optometry.
And how did you kind of fall into that specialty from general optometry?
I During my residency, you in low vision, you're seeing patients who are visually impaired to legally blind, and you're getting exposed to patients of all age groups from birth with congenital eye problems all the way to centurions with age-related eye changes. So part of the residency was to get really involved into examining children. And so I was under the tutelage of Dr. Bill Takeshita, who was the chief of pediatrics for the Center for the Partially Sighted at the time. So I learned how to do low vision exams on pediatrics. In addition to that, he also had a private practice where he saw children. And so after I completed my residency, I worked at the Center for the Partially Sighted, but I also worked with Dr. Bill in his private practice. So that's how those two merged together.
Got it. And so you're in your own practice now, is that correct?
Yes, Dr. Bill retired, and so I went ahead and bought his practice and just continued on under my name.
Very cool. And being that your main patient population are children, I wanted to know from your perspective how early a child should be seen by an optometrist, whether or not they're showing signs of having visual problems.
Yes, so the American Optometric Association recommends that children as early as 6 months of age, um, usually between 6 months to a year, should receive their first just baseline eye exam. The main things you're screening for children of that age is whether or not there are any congenital problems, such as if you take pictures of your baby and you see one whole pupil completely white, that's an indication that he or she needs to be examined to rule out retinoblastoma, which is, cancer of the eye. So that's like the really one of the big ones. But other things that are involved in that would be if you happen to see your baby's eyes shake or wander, if they look like they're turning in and you're not so sure if it's a pseudostrabismus or a true strabismus. Early detection of eye conditions like that leads to early intervention, and with early intervention leads to better success of treatment. So at 6 months to a year, you're gonna assess the child differently versus at 3 years of age or 5 years of age when they are more verbal. At that early of an age, you're really relying on your skills that you have learned through optometry school. You're going to rely on your ability to do retinoscopy. You're going to rely on your ability to assess the from outer to inner of their eyes, and just it's a very fast exam because children, babies at that age, they're squirmy. They some of them are very cooperative, actually. They can sit still, but for the most part you really have to rely on your clinical skills to get a general assessment of how well they're seeing, how well they're fixating on your targets, how well they're moving their eyes following a target, what their peripheral vision is it intact, or are there areas of neglect or defect? And then you go straight into your retinoscopy to assess, is there refractive error within reason for someone of that age, or is it above and is prescription needed? And then you're assessing the ocular health. So those things, once you assess that, you can assure the parents, okay, what you're seeing is normal, let's follow up, or is it warrant a referral to ophthalmologist, a pediatric ophthalmologist, for further testing?
Got it. And you mentioned that you recommend for patients to be seen around 6 months to a year. And I'm just curious, how typical is that you see that parents bring in their children at that age? Because I know growing up for me, as I just went to a pediatrician, and they didn't say I had any signs of anything. And so is it typical for your patient population to come in because they've already had problems, or do you also see patients that are just going in to see a general or an optometrist?
That's a really great question. I specialize in pediatrics, but my niche is in children with significant developmental delays. And so I think that that population is more aware of visual issues as it is in line with all the other developmental delays that their child may have. So I see children who are on the spectrum. I see children with CP. I see children with ROP. I see children who are born with seizures, congenital seizures or congenital cataracts, or any of those diagnoses. And so they and their families have been used to having a team of therapists that are working with their babies, with their child. So a developmental optometrist such as myself is a natural progression. So that I would see them very early on, because all of their therapists, whether it be speech language therapists, occupational therapists, neurologist, developmental pediatrician, are aware of how significant vision and vision development would play a role in that child's overall development. Then you have the next population, such as you, where everything is normal, you don't have any pre-existing health conditions. That's where you kind of have to go out there and market yourself or make yourself be known to your community should you wish to go into developmental optometry. And it's also by word of mouth too. The more kids that you see and the more things that you pick up that go undetected through a general pediatric or pediatrician's examination, the more your name gets around. So that population, you're right, usually you go in, you get screened, you pass the screening test, and you go in year after year for your well check, and really nothing is being asked about an eye exam until age 3. But my daughter, had I not examined her at age 1, we would have not picked up that she was a +10 and that she needed glasses, or else her eyes would start to cross.
Mm-hmm.
So there is an importance for having children be screened at an earlier age, but not everybody is aware of that. So when you are set up in your own practice, it's good to get out there, introduce yourself to the pediatricians, and depending on how far you want to get into pediatrics, and learning delays and academic delays, certainly you want to reach out to the speech language, to the OTs, and to the educational psychologists too. But in general, your first contact person would be the pediatricians to let them know, hey, 3 years of age in some kids is too late. So it's better to do earlier rather than later.
Mm-hmm. Got it. That's very good advice, because I hope more than just optometry students listen to this. So you mentioned that you're usually part of a team of doctors. You work with pediatricians, psychologists, occupational therapists. And so what I was wondering was what you offer to the team as a developmental optometrist in an overall assessment of a patient.
Yes. So, we know the importance of the visual system, right? The visual system guides all the other systems in your body. It guides your vestibular system, your sensory system. Um, it goes hand in hand with your auditory system. So, if there are delays in your visual system, whether it be amblyopia or lazy eye, strabismus, or, turned eye or eye turning out, eyes crossing in, um, or just not coordinating the eyes and the body together, integrating it together. Um, Pursuit eye movement skills, if you have weak pursuit eye movement skills, if you have weak convergence eye teaming skills, poor tracking skills, any of those skills in your visual system that are delayed is going to impact your motor system, your sensory system. So the therapists who are in tune with the importance of the vision as how it pertains to what they're doing will know. They'll do some general assessment of that, and then they'll refer if they have some concerns or red flags. They'll say, okay, we know that having OT for gross or fine motor skills is going to be hindered if we don't assess the vision. Or a speech therapist will know if a child is not able to track or follow their flashcards or any of the tools that they're using to work on speech therapy. They know the vision plays a role in that. If the child can't see well or track well, then it warrants the vision assessment. So that's where working together as a team is really critical, because they're trying to get information from the developmental optometrist as to how well does that child see? Does that child need glasses? Does that child need vision therapy concurrently with what we're doing in order to really make the treatment as effective as possible?
Got it. And you mentioned vision therapy a lot. So could you talk a little bit more about what that is and what you do during those sessions with the kids?
Yes. So a developmental eye examination comprises of your comprehensive eye examination, which is basically what I covered already. But in addition to that, when a child becomes 6 years of age, we start testing their visual tracking skills for reading readiness. And if the parents feel that their child is also behind academically, we want to see what their visual processing skills are too. So let's just say their eyes are perfect. Everything is checked off. They have great vision, great pursuits, great convergence, good tracking, but they're still reading a year or two below grade level. We want to see how their visual cortex, the occipital lobe, how they're processing visual information that is transmitted from the eyes. And so there is a test called the test of vision perception skills that has 7 subtests to it, and it assesses how well a child scores and performs at his or her age level. If everything checks out well in that area, then we know that the learning delays is not a result of their vision or their visual system. So I get a lot of referrals from the school districts, from developmental pediatricians or educational psychologists that may have already ran their testing, and they just need more in-depth information on how that child processes visual information. Let's say we come up with, okay, there are some vision problems, maybe amblyopia, maybe strabismus, and then in addition to that, they have some tracking and visual processing. Based upon the severity of the areas of weaknesses, we determine whether or not vision therapy is deemed appropriate. and whether it's appropriate to have both office-based vision therapy and home-based therapy, or whether a home-based program is adequate with regular checking in and following up with me. So those are the things that I take a look at. I see the severity of it. I determine the length of time that vision therapy would be needed. In my practice, it's just me. So I do the assessment, and then I gauge the severity of it, and then I have a conversation with the parents, and I say where I think vision therapy falls in place with the current treatment that they have as the team. And then we make the decision as to whether or not we do vision therapy or not. There are some cases where I stress that it is priority, that's going to help everything else fall into place a lot easier in terms of treatment. And then there are other cases where I feel that we can circle back to me at some point to do vision therapy, because I think that there are other things that take more priority. Vision therapy, working one-on-one with a doctor, it helps me to, I have no problem with, vision therapists working with a doctor to do vision therapy, but I think what is unique in my practice is that I do the treatment. So I get to see how the child is performing on a weekly basis, and I get to modify my treatment plan or my vision therapy activities right on the spot if I need to. If I see that something is very challenging, we focus on that, and we change the whole program. I could go in thinking that these are the activities that we're going to do for the day, and then as I watch the child do specific activities, I may modify it right then and there. So, and then in other practices, the doctor consults with his vision therapist, creates a plan, but there may not be those modifications right on the spot. So my length of treatment may be shorter than those that are having a collaboration with the optometrist and the therapist.
Got it. So, kind of going off of that, what do you like about your specialty, and what is it like working with population of mainly children?
What I love about it is that these families follow me from the time that their child is a baby all the way to when they go off to college. So I've had kids that I've seen at 2 to 3 years of age, and they've come back, graduated from college, and still come to see me. So, at that point, we transfer them from a pediatric type of exam to an adult exam. Well, I'll tell them, hey, we got to do these types of tests now for you because you're an adult. But that's the neat part of it. I get Christmas cards, I get holiday cards and everything like that along the way. You get to see the progression of how they mature, and the joy of it is that kids are they're very honest. They will tell you exactly what's going on. It's just, that's the beauty of having kids, right? There's no filter. So you get to know exactly what they're seeing, what's happening. Your exams are usually different from one child to the next, because one child will be very well behaved. They'll sit nice and calmly all the way through, and then the next exam you get a wiggle worm, and you have to modify your exam on the spur of the moment throughout the day. So the day goes by really fast. It's enjoyable. They'll share with you their school stories. I'll have kids that come in and they'll call me dude, like I'm just another regular person in their life. Or I'll ask a little girl how school was today, and she goes, oh, it's great because I got back together with my boyfriend, and she's only 6. So it's just it just makes for a really great day. And because some of the cases I see are really complex, it just keeps your brain going all the time. You're never going to see one similar exam after the other. It's always going to be different. So that's what I enjoy.
I like that. And you graduated in 1993. So you've been practicing for over 20 years.
Yes. I would say, let's see, I bought the practice that I'm currently at in the year 2000. And prior to that, I was still doing low vision and the combo with Dr. Bill. So I would say there were probably about 3 to 4 years prior to that. So a total of 23 years or so of
Wow.
doing this. Yes.
And now that it's your own practice, is there any like frustrations that you go through with the population or just owning your own practice?
Yes. So I think my situation, I love. My situation is one where I'm doing office overhead sharing. And so it works for me as a single mom because I'm able to go in, do my assessments, do my testing, and go home and be with my kids. Yes, I have, an emergency line where I can be on call. But really the time that I set aside as a private practitioner, I set my hours, I set my working days, and certainly with COVID, I had to, pivot and make the changes like everybody else did. But I'm able to be in charge, but I don't necessarily have to deal with perhaps all the problems and headaches of staff management because that's part of the office overhead sharing. Um, I pay a percentage, and the doctors that own that practice, I pay part of the rent for the space that I have, and I just go in, go to work. They do all of the billing for me and all of the chart work and everything else, scheduling. I just go in, do my work, and go home. So the situation works really well for me and what my needs are. Some of the frustrations I think, if any, on a day-to-day basis would be just any case that comes to me. Some are very easy and others are heartbreaking and challenging in the sense that if I have a baby that was born premature or went through complications at delivery and then now coming to me with all of these physical and emotional and psychological challenges, then, depending on the severity of it, it can touch your heart and it can make you feel, oh gosh, they've got an uphill battle. But what
Mhm.
I admire about the families and the parents that have children like this is that they are all in. They will do everything in their power, financially, emotionally, time invested to make sure that their child gets everything that they need. And so that's heartwarming to me because in that, you stop and you think, oh, how blessed are you, me, that I have two healthy children, because you get to see families with children that may be not quite as blessed, but yet the love is so strong there that it just kind of puts everything into perspective. So no matter how difficult my day could be or how difficult a certain exam could be, you take a look at the big picture and you walk away feeling very blessed. And if you meaning me could be a part of that team that helps that child get just a little bit better, then I'm happy to know that I was part of that team.
Wow, that is a great way to put it. I can only imagine, and I'm so excited for that moment when it comes for me and my first patient. But in the meantime, I do want to segue into questions that are geared more towards the listeners who have an interest in the profession. So, my first question is, what made you choose optometry over all the other health professions out there?
I knew early on that I wanted to be in the healthcare field. And when I was at UC Davis, I wanted to work while going to school. So I got a job at an optometrist office, and that enabled me to see firsthand what a potential career in optometry could be. And, Davis, I don't know if you know, but Davis is like a small college town, and their office was really neat. They converted a house
Oh,
into an office.
mhm.
So, you walk into this house and you have the entryway and you have the counter where you check in. Their kitchen and adjacent room was set up as the lab for the, where you go and you adjust the glasses and you
Mhm.
fix frames and all of that. And then each of the bedrooms was converted into an exam room and pre-testing room. And so it was really quaint. It was a small town feel. All the patients knew the two doctors that worked there. And I got to work front desk. I got to do optical and glasses adjustment, frame selection. And then eventually you work there long enough, you got to do some pre-testing.
Ah,
So that patient interaction was really neat. And that, I think, solidified my desire to go into optometry school.
Do you know if that building still exists or if
I honestly don't know. I think both of those doctors have probably since retired,
Mhm.
but I still remember their names. It's one of those things where, certain people make a mark and an impact in your life. And those were the two that sort of spearheaded my way in. They wrote me recommendation letters. And then I met one of my good friends that we still stay in touch with. We met through working at Davis there at that office. She went to SUNY, and then she has then come back here and worked here now. But we stayed in touch all through those years.
And then another question, what are your biggest takeaways from being an optometrist, and how has it kind of changed your perspective in healthcare and or your view on the world? I know you touched on it being very heartwarming and taking the bigger picture, but if you have anything else to add to that.
Yes, I think, well, when I first entered optometry school, the ratio of men to women, male to female optometry, was still 2 to 1. It was a male dominant profession.
Mhm.
That has since changed. I think my class was the first class where there was 70% female to 30%
Mhm.
male. And since then, I think, it's trending more female than males. Also at that time, therapeutics was just beginning to take off. Um, and since then, legislation and most of the states have worked, just so hard in trying to push optometry into the next um, level of being able to prescribe. And I think they've done a really good job of it overall. So I think looking at all of that, our profession is now in a position where we can really be in the front line. We're going to be your first tier people, especially in rural areas where there are not a lot of ophthalmology
Mhm.
um, or ophthalmologists around. We're going to be the first group of doctors who are going to diagnose and treat. And the ability to go through optometry school and learn all of the medical aspect of it is so critical at this point to continue pushing optometry forward. So I think that that's very, very important. But the main thing I hope all optometry students can take away from it is that our specialty should and always will be, I hope, um, the art of refraction, the art of prescribing, learning that visual science and optics and understanding what prescribing is all about, because that is our own, that nobody can take that away from us. That is what I view is the uniqueness of optometry. We can prescribe, we can treat, we can do surgery, we can do whatever down the road, and absolutely go for all of that, but never, ever, ever forget the visual science and the optics and how to prescribe, because there's such an art to it. And patients appreciate when you know the ins and outs of using prisms and antipsychotic lenses and all of these other things that are just truly ours and ours alone, that they will come back to you and they will be so loyal and faithful to you. And so I think on a global standpoint, what I would love to do at some point is do those mission works, to go out there to all of these other countries that are developing and are in need, and just provide your services on just the very basic level of eye care. You would change someone's life for the better. So I think looking at it from where we are now to global, that's where I think optometry has such a huge impact.
Yeah, yeah. I've heard so many stories about people putting on glasses for the first time in
Right.
their 20s, even, or even past that. And it just, changes your perspective on how different our country is in the opportunities and the access we have. And I've also heard like patients having to walk like miles just to get to their optometrist. It's
Yes,
so crazy to
yes. And
think, but
so, yes. And so as you enter optometry school and you're required to buy your equipment, yes, we have autophoropters. Yes, we have automated everything, this, that, and the other. But your handheld equipment that you buy, that is your tool. That is your skill set. That is what you need to use. That's retinoscope. Um, because gosh, when you travel to these other countries, you'll be lucky if you have anything automated. You know, when you go on these mission trips, you're going to rely so heavily on your handheld tools, your BIO, your retinoscope. You're going to rely on your ability to scope and to see the reflex and to diagnose, is there cataracts in addition to, you know, other things that you're seeing. So it's going to be basic bare bones types of equipment, and you're just going to have to rely on what you've learned in optometry school. If that is your calling, is to go and do that and to make an impact globally, then take the moment and the time that you have in school, learn from your professors, get as much number of hours of clinical experience as you can underneath your belt, because then you're going to be able to turn around and make an impact on the world and have somebody come and shadow you down the road and, you know, continue this profession forward, that I hope that you will.
Yeah, well, thank you. Yeah, that's really inspirational to kind of bring it into perspective like that.
And it's so uplifting, you know, even in your own practice or at the clinic that you'll be at, when you see a baby or anybody put on their glasses for the first time and they start crying because they can actually see their parents' faces or the leaves on the tree, that is going to be your takeaway. That's going to be the best feeling that you've had for that whole day or that whole week. Or somebody comes back and tells you, I got an A on my test because now I was able to study without falling asleep or getting tired 15 minutes into it. Those are the days and those are the stories that make all the other days, the difficult ones, so well worth it. So definitely, if you have the calling to do that, certainly look into organizations. And I'm sure that the optometry schools are affiliated or have some sort of resource or connection should you want to go and do that.
Awesome. Yeah, I definitely have a big interest in going abroad with optometry at some point. So that's really good advice. I guess my last question that I have on my list here is bringing it back to your specialty. Are there any tips for students with an interest in pediatrics? And do you feel like there's a demand? Do you have a lot of colleagues that you collaborate with in your specialty?
Developmental optometry, there is a demand. I think optometry schools nowadays really try to focus more on the ocular disease management and treatment and contact lens and specialty contact lens. And so developmental optometry is lower on the list. Um, with that in mind, there is going to be a demand for it. Attend your local society meetings. They are open to students. They're free to students, I believe. And that's where you get to go to these CE meetings. You get to meet the doctors that have their own private practice. And if they specialize in the area that you love, sit down, talk to them, introduce yourself, because somewhere down the line, that initial connection could circle back again into something fruitful for you in terms of becoming an associate or perhaps even buying their practice. You know, because as doctors that have been in the practice for a long time, our thought process now at this point is, okay, what's my 5-year goal? What's my 10-year plan? When do I want to slow down? When do I want to retire or sell my practice? And so we're working so hard to build up our practice, but at some point we want to see what the other side holds for us as well. And so making these connections with the young doctors, starting out as students, but later on, seeing how dedicated you are to perhaps taking over our practice, because that we put everything into it. So of course we hope to meet somebody who has share the same passion and dedication. All of those things can help you in building up your name, your reputation, and hopefully getting you to the practice choice that you want.
Great. Well, that is all the questions I have. So I just want to thank you again for being my first interviewee. This was really fun.
Sure, I'm happy to be your guinea pig. I hope that I answered everything that you wanted to know about.
Yeah, I think a lot of people will find this useful. That's why I was asking more about, children, because even though my friends are not having babies yet, eventually people come to the road where they decide to have kids, and they don't really, there's not a lot out there.
I think, and that's a really good point. I think as moms or new moms, you're always like making sure, is my child meeting all milestones? Mm-hmm. So then, as whether you're an optometrist and a mom or not, you're still making sure that your child is meeting all the milestones. And if some of the milestones are not being met, then hopefully this podcast will enable them to understand that, hey, maybe having the child's eyes tested should be on the to-do list, to make sure that nothing is going on there that is impacting their development.
And there you have it. First opt-in episode in the books. I hope you all enjoyed listening in. We have a whole year of podcasts ahead of us. So please, if you have any topic requests or recommendations, feel free to shoot me an email at crackoat@gmail.com. And big thanks again to Crack OAT for sponsoring this podcast. If you haven't heard of them, they provide the most updated and affordable online study material for the OAT. And with the discount code OPTIN10, you can get 10% off the Hero Package online. Thanks again for listening, and happy World Mental Health Day. Remember to be kind to yourself and keep doing what you love.